Rosacea is a common but poorly understood disorder of the facial skin that is estimated to affect over 16 million Americans, and most of them don't know it. In fact, while rosacea is becoming increasingly widespread as the baby boom generation enters the most susceptible ages, a Gallup survey found that 78% of Americans have no knowledge of this condition, including how to recognize it or what to do about it. Because of its red-faced, acne-like effects on personal appearance, it can cause significant psychological, social, and occupational problems if left untreated. In surveys by the National Rosacea Society, more than 76% of rosacea patients said their condition has lowered their self-confidence and self-esteem, and 41% reported that it had caused them to avoid public contact or cancel social engagements. Among rosacea patients with severe symptoms, 88% said their disorder had adversely affected their professional interactions, and 51% said they had even missed work because of their condition. While the cause of rosacea is unknown and there is no cure, as skincare professionals, we must be able to recognize and understand rosacea so we can start the proper treatments for our clients before the signs and symptoms become increasingly severe. Signs to look for are redness on the cheeks, nose, chin, or forehead, small visible blood vessels on the face, bumps or pimples on the face, watery or irritated eyes. Other warning signs to look for when we are communicating our clients and doing a thorough client consultation is burning, stinging, itching, or a feeling of tightness on the face, rough, dry appearance, raised red patches, and facial edema or swelling. There are 4 subtypes of rosacea that will help you be able to assess your client's skin. Number 1 would be erythema to telangiectasia rosacea, or subtype 1, which include flushing, persistent redness, and possible blood vessels on the skin. Number 2, papulopustular rosacea, or subtype 2, which is persistent redness with bumps and pimples that come and go. 3, vitamous rosacea, or subtype 3, which includes skin thickening and enlargement of the nose from excess tissue. 4, ocular rosacea, or subtype 4, dry eyes, watering, burning, swelling of the eyelids, styes, and damage to the cornea that can result in vision loss. It's possible to experience the different subtypes simultaneously, and they can also appear one right after another. Any of the symptoms of rosacea can advance from mild to moderate to severe. What causes rosacea? Although the exact cause of rosacea is unknown, various theories about the disorder's origin have evolved over the years. Various lifestyles and environmental factors called triggers can increase this redness response. One theory suggests the condition may be a result of oversensitive blood vessels in the face. Another theory attributes to the disorder Desmodex folliculorum, which naturally live on our skin. Rosacea sufferers have more of these Desmodex mites than people without the condition. Genetics, family history may play a role. There may even be a connection between rosacea and a stomach infection caused by the H. pylori bacteria. None of these possibilities has been proven, although potential inflammatory pathways have been identified in recent ongoing research. Some questions that you may come across with your clients are: is dry, flaky skin typical with rosacea? It has been estimated that approximately half of all rosacea sufferers may appear to experience dry skin. With proper treatment and home care, the dryness often eases along with disappearance of papules and pustules. Will rosacea get worse with age? There is no way to predict for certain how an individual's rosacea will progress, although physicians have observed that the signs and symptoms tend to become increasingly severe without treatment. In a National Rosacea Society survey, about half of rosacea sufferers said without treatment, their condition had advanced from early to middle stage within a year. Fortunately, compliance with skincare professionals and lifestyle modifications to avoid rosacea triggers has been shown to effectively control its signs and symptoms on a long-term basis. How long does rosacea last? Rosacea is a chronic disorder rather than a short-term condition and is often characterized by relapses and remissions. A study of 48 previously diagnosed rosacea patients found that 52% still had active rosacea with an average ongoing duration of 13 years. The remaining 48% had cleared, and the average duration of the rosacea had been 9 years. Rosacea patients who continue skincare therapy for the long term are less likely to experience a reoccurrence of symptoms. Understanding rosacea and knowing what products and ingredients to utilize in clinic and recommend as home care, much can be done to relieve signs and symptoms. As skincare professionals, our main goal is to limit its progression by detoxifying and nourishing the connective tissue from within. The treatment of rosacea should incorporate GlyMed Plus products that contain ingredients such as AHA or alpha hydroxy acids has so many benefits for rosacea, including promoting the development of blood vessel, aiding in reducing inflammation, helping to control desmodex mites in the follicles, and contains antioxidant property, improving cutaneous atrophy by increasing epidermal thickness. Daily application of AHAs in conjunction with chemical peels in clinic will improve erythema and strengthen the stratum corneum. Sulfur, which is a natural mineral, is effective in retarding the genesis of bacterial infection by reducing oil gland activity. Sulfur assists in shedding excessive skin and fighting bacteria, preventing attachments of the desmodex mite. Sulfur is amazing in stimulating healing. Enzymes are natural and gentle to help exfoliate while decongesting the skin, causing treatment and hydrating products to penetrate deeper, causing them to be more effective. Tyrosinase inhibitors, such as our age management living cell clarifier, not only helps to calm inflammation, but it also is a natural astringent, antiseptic, hydrating, and rich in antioxidant vitamins to combat free radical damage. Peptides are integral in treating rosacea. Because the skin is in trauma and out of balance, when the tissue repairs itself, it requires more amino acids for cell proliferation. Not only do peptides have the ability to reduce inflammation, it helps reduce the aging factor linked with photo-damaged skin. Effective moisturizers that contain amino acids, ceramides, and hyaluronic acid to help combat dryness associated with rosacea. And of course, we cannot forget our SPF, which will protect the skin from environmental exposure and UVR to prevent further damage. I would like to highlight our featured product of the month that is beneficial in treating all rosacea, the Rosacea Relief Cream. It works by reducing the appearance of rosacea naturally and effectively. The main ingredient is the horse chestnut botanical extract, or ACEN, which helps to reduce inflammation. It works by improving vein walls by plugging minute holes and microscopic leaks in the venules and capillaries. It promotes elasticity and prevents swelling, and it repairs long-term damage caused by internal skin heat and irritation brought on by other imbalances. Rosacea is not fun for anyone, including the sufferer, so it is our job to understand the skin condition, perform thorough skin assessments, and have our clients commit to schedule regular appointments with you as their skincare specialist. As a chronic disorder, rosacea can change or worsen over time, and regular in-clinic treatments along with a proper home care regimen will keep your clients loyal and happy.
Rosacea peeling treatment for mild to moderate rosacea, sensitive or inflamed skin. Step 1. Dispense 1 pump Cell Science Mega Purifying Cleanser into the palm of your hand. Blend together and evenly apply over the face, neck, and décolleté area. Add more cleanser if necessary. Thoroughly massage and cleanse the skin. Remove with damp facial cloth. Step 2. Apply 2 pumps Age Management Gentle Facial Wash to wet hands. Massage facial area for 1 minute. And remove with damp facial cloth. Step 3. Dispense half a teaspoon, professionals only lactic action 30% exfoliator with half a teaspoon Cell Science Rosacea Relief into a glass dish. Apply the peel mixture with a soft fan brush to the face, beginning at the forehead, followed by the outer perimeter of the face, nose, chin, upper lip, down the nose, and ending with the cheeks. Lightly massage in a circular motion. Allowed to remain on the skin for up to 5 minutes. Remove peel with damp facial cloth. Step 4. Spray 2 cotton rounds with Cell Science Skin Recovery Mist and apply to face, neck, décolleté area to complete the rinse. Step 5. Apply 1 pump Age Management Living Cell Clarifier to entire treated area. Massage gently until product has been fully absorbed. Step 6. In the palm of your hand, mix half a pump Cell Science Ultra Hydrogel and half pump Cell Science Cell Protection Serum. Gently massage onto face, neck, and décolleté. Step 7. Apply half a teaspoon of Cell Science Rosacea Relief to the entire treated area. Massage until fully absorbed. Step 8. Finish with an application of Photo Age Environmental Protection Gel 15 or 30 to the face, neck, and décolleté area. The National Rosacea Society, NRS, designates April as Rosacea Awareness Month to educate the public on the impact of this chronic and widespread facial disorder, now estimated to affect more than 16 million Americans. The goal of Rosacea Awareness Month is to actively spread public education on this disease so that more people who have this condition seek medical help before it gets worse, and so those whose lives are affected can find greater public understanding. In honor of Rosacea Awareness Month, GlyMed Plus is holding a 20% off special all month long on the Rosacea Relief Cream. To get this special and learn more about our GlyMed Plus products, call our corporate office at 1-800-676-9667 and don't forget to like us on Facebook.